Chapter 38, Assisting with a General Physical Exam. To confirm a patient's health status, physicians usually perform exams on a routine basis, such as once a year. Some exams are done to fulfill a requirement before an individual starts school, begins a new job, or starts an exercise program. A clinical diagnosis is made based on signs and symptoms. A sign is objective, information that is seen visually by the practitioner or proven through testing. A symptom is subjective information supplied by the patient. Signs and symptoms are assessed to determine the correct diagnosis. A differential diagnosis is when two or more diagnoses are possible. The prognosis is a forecast of the probable course and outcome of the disorder and the prospects for recovery. The role of the medical assistant is to provide comfort and safety to the patient and competent assistance to the physician during a general physical examination. Safety precautions for a general physical exam are outlined by the Department of Labor's Occupational Safety and Health Administration, OSHA, and the Department of Health and Human Services. Centers for Disease Control and Prevention, CDC. Safety measures protect the physician, patient, and other staff from disease transmission. Patient modesty and privacy concerns should be respected. The practice of having chaperones available on a consistent basis for patient examinations is recommended. The goal is to respect the patient's dignity and to make a positive effort to secure a comfortable and considerate atmosphere for the patient. Provide appropriate gowns, a private facility for undressing, sensitive use of draping, a clear explanation on various components of the physical examination. Ensure a policy is in place for patients to request a chaperone of the same sex. A symmetrical body is less prone to injury because compensation for a weaker muscle group may overburden the system. If the patient is able to sit unsupported, the physician is able to examine for symmetry of the patient's head, neck, chest, heart, back, and arms. If in the recumbent position, the patient is lying down and draped from the neck or underarms down to the feet. For the dorsal recumbent position, the knees are drawn up. In the lithotomy position, the patient has her feet in stirrups. This can be embarrassing and uncomfortable, and the patient should not remain in this position longer than necessary. A large drape is used to cover the patient from the breast to the ankles. In Fowler's position, the patient is supine, but the head is elevated at a 45-degree angle. In the Sims position, the patient lies on the left side with the left leg slightly bent and the left arm behind the back. The right knee is bent and raised toward the chest. The patient is draped from the upper back to the feet. In the prone position, the patient is lying face down. This position is unsuitable for women in advanced stages of pregnancy, obese patients, patients with respiratory difficulties, and the elderly. In the knee to chest position, the patient is lying on the table face down, supporting the body with the knees and chest. The knee to elbow position is an alternative for the same purpose. The patient is commonly covered with a fenestrated drape, which has a special opening that provides access to the area being examined. Proctologic or jackknife position can be used as an alternative to the Sims or knee to chest position. The patient can assume this position by standing next to the examining table and bent at the waist until the chest rests on the table. Patients from a different culture may not be familiar with the medical exam and may not know what to expect. They may be more modest than other patients and have a greater need for privacy. Patients with physical disabilities vary in their ability to move from place to place. Many will require the use of wheelchairs, canes, or walkers. These patients may require extra assistance with disrobing, transferring to the exam table, and assuming certain positions. General and local inspection can simply be done with the eyes, but there are a multitude of tools which are also helpful, including a large range of scopes and imaging. Auscultation, listening to body sounds, is done almost exclusively through the use of a stethoscope. When the physician uses palpation and lays their hands upon the patient, the physician perceives physical signs by tactile sense, temperature sense, and kinesthetic sense of position and vibration. Percussion is the method of examination in which the surface of the body is stuck to emit sounds that vary in quality according to the underlying tissues. Mensuration is the process of measuring. Manipulation is the systemic moving of a person's body parts to determine a joint's range of motion. Most physicians begin by assessing the patient's overall appearance and the condition of the patient's skin, nails, and hair. The medical assistant will have ready the basic items necessary for a general physical exam. The head and neck are checked for symmetry and range of motion. Lymph nodes are also palpated for any sign or signs of enlargement. The eyes, ears, nose, and throat, EENT, are checked for any signs of decrease or abnormality. The nasal mucosa, lining of the nose, is a special focal point to check for any discharge, lesions, obstructions, swelling, or inflammation. The use of a tongue depressor to keep the tongue down and out of the way is often handy for examination of the mouth and throat. The patient may be asked to breathe deeply to check for signs of dizziness. A patient who becomes dizzy during deep breathing may be hyperventilating. The chest is checked for shape, symmetry, and postural position. Kyphosis, or humpback, is commonly seen in the elderly. The physician will note the heart's rate, rhythm, intensity, and pitch. During every general physical exam, every woman should have a complete breast exam to check for signs of cancer. Men's breasts should also be checked for lesions or swelling. Examination of the abdomen begins with inspection and auscultation, followed by percussion and palpation. The abdomen is typically divided into 4 equal sections or quadrants. Female patients may feel anxious or self-conscious in the lithotomy position used to examine the genitalia. The medical assistant helps to keep the patient relaxed for this portion of the exam. Men may be just as embarrassed or uncomfortable as women. Having a member of the same sex in the room as a chaperone during examination of genitalia is recommended for patient comfort and staff integrity. A digital examination of the rectum is commonly performed with a gloved and lubricated finger. The physician may require that a stool sample be obtained from the glove following the examination. After the rectal exam, the patient should be offered an opportunity to clean the area of excess lubricant. The musculoskeletal system is an overall check for range of motion and strength of various muscle groups. The physician will ask the child to bend at the waist to check for the presence of scoliosis, a lateral curvature of the spine. The neurologic system is assessed for function of the patient's reflexes, mental and emotional status, and sensory/motor abilities. After the physician completes the exam, the medical assistant should help make the patient comfortable. Additional tests and procedures may require obtaining blood samples or preparing the patient for a diagnostic or therapy session. The patient should be helped off the examining table and allowed to dress in privacy. The patient may need further education about risk factors for disease. Follow-up will vary by patient, but needs to include scheduling future visits inside and outside the office, in addition to planning for any help at home and advising on community assistance. Critical thinking skills will be employed to fit the individual needs of the patient. For this week's discussion board, please answer the following question. What would you do if a patient came into the exam room and was completely terrified of the procedure of the general physical exam? What information could you give the patient? How could you help ease their fears? Are there any resources that you could use to help the patient feel more calm and relaxed?